if anyone has open sores or rashes or breakouts, that isn't a good idea either, because we are making an entry point and inserting a foreign object under the skin, which already there are bacteria that live on the skin as a part of our microbiome, and we don't, if there are extra bacteria that are nasty, we don't want to introduce them. Also, this one gets a little more complicated, but a history of unsuccessful treatments with previous threads of whatever kind. This may be a patient expectation or satisfaction issue. And it's unlikely that you would be the one to succeed if everyone else has failed. Immune and coagulation diseases, we've seen some issues with this, and I would be very, very careful here and make sure to take a good, thorough past medical history on every patient regarding previous blood clots or family history of such, because we are disrupting platelets and it can initiate coagulation cascades that we might not want to see.
What can happen potentially if we're treating multiple things on the same day while also doing PDO threads?
Yeah, we can really talk about it. The only thing that I would say is we frequently do multiple treatments of different things in the same day, and I just would say that it would just raise the bar for being on alert for complications such as infections, because we're causing more trauma to the skin and potentially introducing more areas of entry point for bacteria, and also mixing treatments can be it's usually a great thing, but you also have to keep very close track of what exactly you did and where you did it, because if there's a complication, you'd want to know what caused what. If you place a thread and it starts to come out, like we were just talking about the vermilion border here, it looks like that.
Yep.
That's a very common thing to happen. That's a hard place to get threads to stay, because you're moving your mouth all the time and it just wants to push it out. It takes a while to learn how to do this, and even once you do it, this can still happen. It just happens. And if you see a thread coming out, you just pull it out. It's not a big deal. Infections can happen, and that they're not very common, especially anymore, since we've been encouraging people to, if you're placing especially more than one or two threads, to give a bit of prophylactic antibiotics, maybe even for a day or two, just like you would around the time of surgery. If you're having a shoulder washout or something, the surgeon will give some antibiotics around the time of surgery, just because you're making holes in the skin and putting things in there. So that has really reduced the number of infections to almost none. So we highly encourage prophylactic antibiotics. It's been said, and you can read that over a certain number of threads that you should do it. I think it's good standard practice, and we should all be at least mindful of thinking about it.